Um, Thanks for having me. It's been really good. I'm sorry I missed the first couple papers yesterday morning, but really enjoying the conversation. So this is joint work with Aaron Petty and Derek Christensen. And what we're interested in analyzing in this paper is the effect of the food stamp program, which is great. You heard from Jay yesterday a little bit about what food stamps is. And what we're interested in is looking at the effects of food stamps on child health. And there's a lot of research on food stamps in the economics literature. I would say it's mostly focused on, looking at the effects on labor supply, measuring sort of contemporaneous effects of the program, mostly focused on the household and the parents. And there's not as much work on looking at what the effects on the children are. And the children are a big share of the food stamp population, of folks who receive food stamps. And just to sort of tee up why this is a harder problem to study than you might think is, essentially food stamps is a very federalized program. It's run out of the USDA. It does not very much vary across places in the United States. Now that's true of other programs like Social Security and federal earned income tax credit, but additionally there haven't been that many reforms to the program over time. And so those two elements have made it, in my mind, a program that is actually quite difficult to study. But it's really important. You can see some facts about that. Right now, the data shows that food stamps alone raises more than almost 1.5 million children out of poverty. And as Jay pointed out yesterday, at the peak of the Great Recession, a lot of people were affected by that program. So what we do in this paper is introduce a new source of variation to try to analyze the effects of food stamps on, in this case, children's outcomes. And we essentially leverage the fact that the program does not vary across space, but use the fact that prices of food vary across space in order to construct a measure that we call the purchasing power of SNAP, which is just the food stamp benefit divided by the local price of food, and use variation across places and over time to identify the effects of SNAP on kids' outcomes. So I kind of already mentioned this. Why is causal identification difficult with SNAP? Another element that makes it hard to study, I said it was sort of universal across space and hasn't varied across time that much. Another aspect is the program is, I would say, the most universal program in the United States that serves the non-elderly. So what do I mean by that? Most of our safety net, particularly for the disadvantaged in the United States, is targeted at particular groups, basically children and the disabled. And so, for example, people without children are not eligible for very much in terms of our social safety net, and the ACA has corrected some of that. But food stamps is a program that's always been essentially serving everybody who's income eligible. And that's unusual. So there's a way in which the program is deeply fundamental in terms of being sort of what I think of as the fundamental safety net in America. It's the one thing that everybody should get. There's important groups that are not included, like non-citizens and the time limits on people without kids, but it's really important in that way. But that universality makes it hard to find control groups. So for example, the EITC literature, while that's also a federal program, essentially people without kids get very little access. So there's a kind of a whole number of papers that looks at differences in outcomes for people with kids to without kids to try to identify the effects of the EITC. So those usual kinds of quasi-experimental tools, though imperfect as they are, aren't really useful in this setting. There's really no control group to use. So it just makes it hard. And the point that I was trying to make in Jay's talk yesterday is that there's also a lot of evidence that there's pretty significant negative selection into who ends up on food stamps. So it's, despite great efforts to try to do kind of basic observational regressions and control for what you can, it's just not very convincing. So it's a little bit of a difficult evaluation problem. So what have people done? There's a lot of studies and there's a lot of really good work on SNAP. So we're certainly not claiming we're the first people to find causal estimates or attempt to find causal estimates of SNAP. So this would be my list of the different kinds of approaches that people have used to try to estimate what food stamps does. The first one is sort of the old, commonly used fixed effects, family fixed effects estimator or sibling fixed effects estimator, or some other dimension of that might be you observe families moving in and out of eligibility for SNAP. You have to confront the usual question of, well, what created the difference between a period of time when a family didn't get SNAP and did get SNAP, and are those things correlated with what you're interested in? But nonetheless, there are papers that do that. There is variation across states in the program, so I overstated it a little bit to say that there's no variation, and in particular, states have a lot of control in the local administration of the program, and they actually pay. This is a federally funded program. The only part that states pay is what they pay out of pocket for the administering of the program. And there's a lot of variation across states in what they do, whether you can file online or have to come into the office, all sorts of different kinds of hurdles and restrictions and how those vary across states. So there's some very good work that kind of leverages the available variation to look at the effects of SNAP by essentially having a first stage that shows that how these programs work on the ground affects how many people use them, and then that's a first stage for looking at whatever you're interested in. And then there's other kinds of policy variation that have been used. Either there was something that Jay didn't talk about, is that part of the stimulus package was a 15 or 14% increase in food stamp benefits that kind of sharply turned on one month, and then 2 years later sharply turned off. So depending on the kinds of questions you're looking at, that sharpness might create some opportunity to look for impacts.
In general, people haven't looked at regression discontinuity with gum cutoffs.
So regression discontinuity is not a great strategy in this setting, and the reason is, unlike say Medicaid, where, I think there's two reasons why that's not a good idea. One is, in Medicaid, you either get Medicaid or you don't. Your income is below the cutoff and you're eligible, your income is above and you have nothing. Food stamps is a benefit program that gets phased out as your income goes up. So there's no discontinuity at the eligibility. It's, if you have no income, you've got more food stamps, and as your income goes up, your benefits are reduced by like 30 cents on the dollar. So there's not a cliff or a notch.
But you could do a kink design, right? I guess with that kind of.
The other problem is you generally don't do RD on income because it's so manipulated.
It's so, yeah.
So I think because of that, it's just not a good strategy for those two reasons.
I feel like with kink designs, you need so much data.
Also, yeah.
But you would need, it's like that. Then you're living off of marginal variations. I think that it's not a very. I don't know. Maybe I could be convinced otherwise, but ex ante doesn't seem like a great approach. Okay, and then I also have a bunch of papers that sort of go to the historical origins of the food stamp program, where it turns out that the program, when it first started in the 60s and 70s, was rolled out in this kind of bureaucratically eclectic way over about 15 years, from the first parts of America that saw the food stamp program to the last parts. So I've got some work that leverages that variation, both looking at short-term effects, and I now have also some work on the longer-term effects of food stamps from that. So anyways, this is probably too much detail, but just like there's plenty of really good studies out there. And so we do something a little bit different and construct a measure of the SNAP purchasing power, which, as I said, is just like the non-varying benefit in the United States divided by a measure of a local price. And so what we're capturing, the effects of SNAP, is operating through variations in trends in prices across areas. And so I'll talk about that a little bit, about how we measure that. And the headline findings that we have is that sort of the most robust and consistent findings that we have show that increasing purchasing power of SNAP leads to a reduction in the number of absences from school for children, and greater sort of compliance with going to the doctor for annual checkups for children. This is looking at effects on children. So I'll talk about that and what our sort of interpretation is. Yeah?
So is eligibility based on your poverty level?
So to be eligible for SNAP, I think that's coming up, so I'll tell you.
But that
yeah.
does vary across right? Because the poverty level
No,
varies across
all,
states,
despite
right?
the fact that we have this supplemental poverty measure that does vary across space, everything in the US regulatory system is based on official poverty, which is the old one, which is just a national poverty line. So there is no variation in school
it's
lunch or SNAP or Medicaid or anything else that depends on local poverty lines. It's national poverty lines.
Oh, I thought.
So official poverty in America is still what was defined in 1963. That's official poverty. Because there was just too much of a fight, like there's gonna be winners and losers if you change the poverty measure, and they could not reach consensus on that. So instead, this is probably way too much detail for anybody who is not interested in this, but the supplemental poverty measure is literally a supplemental poverty measure. Nothing, it does not trigger any sort of inter-agency flows of resources in America.
I thought I thought for Medicaid that we have
No.
a paper on Medicaid and we have like this local poverty. Maybe I need to
I mean,
look at that.
I could be wrong, I could be wrong,
Yeah.
but I'm quite sure that it's the federal poverty line.
Okay.
But correct me if I'm wrong, that would be really important to know.
This is local food price, right?
Yeah.
Right. So, but local food price will be correlated with other local prices for
Right.
other things, right?
Yeah, so I'll talk about that. It turns out that in our models, the only thing that's quite important to control for is local economic conditions. Because food stamps is a highly cyclical program, and food prices are correlated with labor market fluctuations. So controlling for the local unemployment rate or other measures does make somewhat of a difference. But once we do that, adding other prices, which admittedly we have imperfect measures of, doesn't really change things very much. I'll show you that. Okay, so why might SNAP affect health? So I organize my thinking into sort of three different buckets. One is the sort of direct channel of having higher purchasing power could lead to a more higher quantity and quality of food, and that could have a mechanistic effect on your health. The indirect effect is more relying on the observation that food stamps is quite fungible, and it is just relieving your budget constraint more generally. And so there may be other things that you purchase with that income effect of having this greater transfer that could lead to improvements in health. And then the third category, and our evidence I think is the most consistent with the third category, but I don't have a lot of clean mechanistic evidence to support it. It seems like the results are most consistent with this. And that is that having a higher purchasing power, as a nod to this emerging literature on poverty, scarcity, and decision-making under constrained resource environments, suggests that if you think about attending school and going to the doctor to bring your child to the well visits is partly your ability to kind of do what you should be doing, and how that's alleviated by having a bit more resources. The reason why I think our results are most consistent with this channel is other measures of health that we have don't show anything robust and statistically significant. And so whether absences from school are a proxy for health, or which they could be, and maybe we're just not powered up to measure the other things, I don't know, but that's just like my current thinking is that they're most consistent with this. But when we look kind of directly at the measures we have for maternal mental health, we don't show statistically significant effects there, except they all have the right sign, but maybe the bottom line is I'm just not powered up to be able to say much more than that. Yeah.
I was wondering if another channel could be take-up. I mean, the program is more work, the hassle cost of signing up, but the purchase is more. And
Yeah.
once they sign up for SNAP, maybe they also sign up for Medicaid. I guess they both have incomplete take-up usually.
Yeah, so the first thing I'm gonna show you is I'm gonna rule out that this is operating through changes in the caseload, which honestly seems a bit strange to me, but the answer is it doesn't. I mean, you'd think like it's a very basic finding is when a program is more generous, more people end up on it. So all I can tell you is, and I'll show you, that it doesn't seem to be operating through that. And this population, the children anyways, you're right, there's not complete take-up. But if I look, and I don't even know if I included it in the slides, though it's in the paper, there's no effect on any kind of health insurance measure nor any other element of the social safety net we can measure. So it doesn't seem to be operating through more of something else, at least to the extent to which we've been able to analyze that in our data. So we can come back to that. There's not much work on SNAP and child health, I would say. And there's a couple of papers that look at the effects of SNAP on birth outcomes. So I have a paper on that, and there's also a paper by Curry and Moretti on that. Chloe East, who was actually an awesome student of mine from UC Davis, wrote her whole dissertation on the effects of SNAP on child outcomes as kind of manipulated through changes that affected immigrants through welfare reform and subsequent legislation. So there's some sort of evidence there for a part of the population, and actually our results are kind of consistent with hers in that she also finds this important effect through this channel of absences from school. I'm not going to tell you about these studies, but I did want to sort of flag that, particularly more broadly through public health and other domains, probably the most studied thing in food stamps is how does it affect food insecurity, as after all, that's basically in the definition of food stamps as to why we have it. And I bring this up only because this literature, if you go back to that first slide where I said how have people looked at effects of SNAP, there's papers almost in every one of those categories that looks at food insecurity because it's such an often measured-ish thing. So we're going to look at that too, and it's not going to tell us anything new. As I mentioned, we know a lot about SNAP does reduce food insecurity, but it's sort of helpful to see with this new source of variation that we're finding something sort of consistent with the existing literature, and indeed we find that this higher purchasing power does lead to an improvement in child rates of food insecurity, though not this like extreme measure of food insecurity, which I'll tell you about when we get there. So a little bit more on SNAP, just to give you an idea about how big it is. So the average household gets about $250 per month in food stamp benefits, or about $4 per person per day. And you can use this, as Jay said, most states have this on a debit card now. It used to be an actual currency. It was interesting, it was like distributed through the Federal Reserve System, just like income. Interesting, I mean like currency. Interesting side point, but I think that's really all I need to tell you from here. To kind of zoom out a little bit, as someone, like I study the social safety net, I'm not like a SNAP person, I'm more of a social safety net person. This gives you a bit of an idea about how big SNAP is compared to other expenditures that we have, and this is just looking at spending on children. And so you can see that among these programs that are aimed at children, or that cover children, Medicaid is the most expensive, followed by the tax credits, the EITC and the child tax credit, and SNAP comes after that. And then you can also sort of see in this dimension of not just spending, but anti-poverty targeting. You can see that using the most recent year of data, that SNAP is the second most important anti-poverty program in the United States for children, for the population at large. It features a bit further down that list. So it's important. That's the point of this. As I mentioned, there's income eligibility requirements for SNAP. So this goes back to the question before, and effectively the kind of critical element that is you want to think about is basically your net income needs to be below the poverty line. So this is a program that is targeting people below the poverty line. I think I already mentioned that the program takes the form of a voucher. You can essentially buy anything in the grocery store that is food. So you couldn't buy diapers or paper towels or alcohol, but you can buy any kind of food. It's not targeted at good food or not good food. It's just food in the grocery store. It's very close to cash is what we observe in terms of people's behaviors, because it's so unrestricted and what you can buy with it. Okay, so the purchasing power. Keep an eye on time here. So the benefit level for SNAP, how much a family gets if they don't have any income, is built up from the ground up, from something called the Thrifty Food Plan. So what USDA does is it sort of goes to consumption data, looks at what people purchase, uses that and looks at nutritional guidelines and basically comes up with a basket that is meant to be the way to meet the nutritional guidelines at low cost. That's what it's not, it's like it's a built from the ground up sort of measure of how you get to the food stamp benefits. And then year on year, using changes in prices, that food stamp benefit is updated. So another aspect of food stamps that's pretty unusual, like take minimum wages, they're almost always set nominally, not in real terms. SNAP is set in real terms in the sense that it's updated each year. So it, adjusting for prices, the program's been extremely constant over time, in part because that's baked into the formula. So what we do is we take this thrifty food plan and we price that out in different parts of the United States. And so we're using this data that's built off Nielsen data called the Quarterly Food at Home Price Database to price out the cost of the thrifty food plan across different markets in the United States. Now, the downside of this Quarterly Food at Home Price Database compared to the broader Nielsen data is the areas are pretty large. So these are the geographic areas in this Quarterly Food at Home data. There's 35 different market groups. And I'm sorry, this isn't very clear, but so down here, we've got this big area. This would be area 16, would be where we are. And you can see this area 99, it's basically the balance of regions outside metropolitan areas are pooled together. That's how they do it. So they've got 26 metro areas and then non-metro balance of certain regions of the United States. That's how they put this data together. So that's what we have for the measure of these food prices across areas. And we then use this data, and we've got about 11 years that we can track this data from the Quarterly Food at Home database to measure this thrifty food plan cost and how it varies across places and over time. And so if you just look at one point in time, this is at the beginning of our panel, you can see, and the darker the area, the higher the purchasing power. So it's the SNAP benefit divided by the price. So a higher value of that is more purchasing power. And so you can see that there's the highest levels of purchasing power in sort of a lot of the upper Midwest, with then the next area being, these parts of the Southeast and the South, some parts of the Southwest, and then higher cost areas such as where we live and other parts of New England. So it maybe doesn't look that surprising in terms of the kind of global variation across the country. There's a fair amount of variation nonetheless within these areas. Of course, any model we're going to estimate is going to include fixed effects for these geographic areas. There's much that differs about them, and fixed effects for time. Well, what's left? So this is just like a spaghetti graph of all the different areas we have, and just plotting the value of the thrifty food plan price over time for our area, and just calling out a couple of areas to just sort of illustrate what's going on. So San Francisco and metropolitan New York are consistently the highest, most expensive thrifty food plan price areas. But you can see that San Francisco and metropolitan New York follow a somewhat different path over this time period. And this seems to be following a little bit the sort of, the back in the in the 2001 kind of dot-com bubble that maybe people remember, maybe they don't. And a quite different path between San Francisco and New York. You can see that, for example, Chicago, near where I grew up, has much lower prices and has different kind of fluctuations. So this is just meant to kind of illustrate, just in a very basic way, that there is variation across areas in the United States. And so we basically estimate a simple model where we put different measures of health outcomes on the left-hand side, or health measures. We, of course, are going to control for area and time effects. We're going to control as best we can for other things that vary at the area and time, like prices that somebody asked about, other social safety net programs and what's happening in different states and over time, the strength of the local labor market, et cetera. That's all in this Z. And then our main measure is going to be the log of the purchasing power of SNAP. And so our coefficients will tell us something about if the purchasing power goes up by 10%, how does that affect the outcome? So what kinds of things do we include in that Z measure? We've got this long list of the policy variation across states that I talked about earlier, just to make sure that that's not correlated with the price variation. Different social safety net programs, I kind of list what we include here. I didn't say, but each one of those Nielsen-defined areas are all combinations of counties. So they're just aggregated counties, contiguous county representations. And so depending on what we observe in the data, if we can measure something at the county level, we just put it in at the county level. If we can only measure it at the state level, we put it at the state level. So for example, we can measure, control for the county unemployment rate, and I'll show you that the results are robust to adding more measures of the labor market besides just unemployment. We can look at our earnings and employment measures at the county level. We can control for housing prices, at least for low-income individuals, which you can get from this HUD fair market rent data. And we can control for the prices of other goods. And the best that we have from that I know of comes from this regional CPI measure. And what we're gonna find is that once we control for this, adding these others doesn't change very much, and whether we control for these or not doesn't make a big difference. Yeah.
So the Nielsen data, it's just an average of all prices across all supermarkets in the area. So some
Yeah,
places will
so the Nielsen data, for those who haven't used it, they have two different products. One product they have is just store level data, and basically imagine this as being a kind of longitudinal data at the store level that gives you information by the UPC code, so a 20-ounce box of Cheerios would be a UPC, and it would tell you the quantity purchased and the total revenue from those purchases, so you can construct a price. The other product that Nielsen creates is it's a household panel. It's much smaller because they're following people over time. People come back from the store, they put things through a scanner, or they use the receipt from the store. And so think of that as being, it's a broader measure than the store panel, because the store panel basically just uses big chains.
Right. Okay.
And the household panel, in principle, includes everything. And so the quarterly food at home data is driven off of the household panel. So think of it as being, all of the food that people buy at small stores, big stores, and everything else.
And can you get the poor people with this panel?
Yeah, so I'll show you something on that. The main data that they provide is for all,
Right.
not for the poor. But I'm going to show you some results, and we have more in the paper, that basically kind of take given products like a quart of 1% milk,
Mm-hmm.
and look at how the prices vary between all consumers and low-income consumers across areas, and they're remarkably lined up.
Oh, that's
So
interesting.
I think that the biggest limitation of the Nielsen data for what we're doing, to just put it out there, I think is less that it's not focused on the poor, but more, it's not a real price index. So I'm not a macro person, but what a real price index does is literally holds the goods constant and prices them out over time. What the Thrifty Food Plan manifestation in this data does is instead says, here are the categories of food, like for example, take fruits and vegetables. The Thrifty Food Plan says you need to consume so much, but you can consume it through fresh fruits, frozen fruits, and that's all in one category. So if in the face of different prices, people shift out of, say, fresh into frozen, that's gonna show up, because in this data, it's not gonna be holding the goods constant. So what would be better is to build up a price index that literally has a fixed basket. And that's what we don't have. So I think the biggest threat to what we're doing is that the changes in the price over time could reflect people, at least within categories, shifting, or they could also be shifting where they shop.
Right.
So if that's correlated with the overall kind of deep primitive that we're looking for, which is whatever it is that's driving changes in prices across area that has to do with local demand and changes in store opportunities and so on, we could be conflating that. I think that's the biggest weakness, a bit less that it's not exactly the population. At least from my investigation, that's the thing that keeps me up at night. Not exactly. Okay, so the main data we're going to use is the National Health Interview Survey, which is, I'm sure everybody in this room knows, it's like a big cross-sectional data set. We use it in the census RDC, which gives us access to county of residence. And so with county of residence, we can build up our price measure. And this is a project that's focused on children. And our main sample is going to be children who are citizens, because non-citizens are not eligible for SNAP, that are in families that report receiving SNAP. Whether we use a proxy for that, like using mother's education level to identify a low-income sample, a high SNAP sample, we find very similar results. Okay, so what are we gonna look at? We're gonna look at food insecurity, as I mentioned, because it's a very commonly studied thing. We're gonna look at, this is what we can essentially observe in the health interview survey. We have measures of utilization as well as measures of health outcomes. And the little blue things here are just from the model and from the discussion early on about the pathways. This would be my expectation about how greater food purchasing power, SNAP purchasing power would be reflected in terms of the outcomes that we have. So let's start by looking at the question about does use of SNAP change, because that's like first order important to get out there. So this is not using a health interview survey. This is using USDA measures, which we can get at the county by year level of the total number of people on SNAP. And so the first column here critically does not include the unemployment rate. But if you put fixed effects for county and fixed effects for time, you'll see that a higher SNAP purchasing power does lead to higher SNAP utilization. It's not huge, so the effect of a 10% increase in SNAP purchasing power leads to a less than 1% increase in SNAP caseload, but it's statistically significant. You can see, however, that simply adding a measure of the local labor market fluctuations makes that go away. Both the magnitude goes way down and statistically insignificant, but then if we add all these other measures, the other policy controls, the regional price measures, and so on, doesn't really change it any further. So we conclude from this that it's important to control for the local labor market measures, but maybe the other ones, everything I'm going to show you is just going to show you this model with it's fully saturated, but it doesn't make much difference if we include these. Okay, so we conclude from this that once we control for the kind of confounder of the local labor market that also co-varies with prices, we don't see a change in utilization of SNAP with the increase in the SNAP purchasing power. This takes things a little bit further and adds these more detailed measures of the county level employment by sector and average wages by sector from the QCEW data, and that also doesn't change things very much. Okay, so we look at food insecurity. We saw that yesterday in Jay's paper. Food insecurity is measured by USDA as basically counting the number of affirmatives to a series of questions. And I know you probably can't read this, and I will not read them, but essentially from this list as you go down, they get more severe. So at the top of the list, we couldn't feed our children a balanced meal because we couldn't afford that. Was that often, sometimes, or never true for you in the last 12 months? So that's a fairly, maybe we'd say a moderate measure of food insecurity. Yet when you get down to the bottom, the last 12 months, did any of the children ever not eat for a whole day because there wasn't enough money for food? Yes or no? So, but oddly, the way USDA measures this is they just count up the affirmatives, even though some are much more extreme than others. But that's what they do. So we start by measuring that in our data, and we find that an increase in the SNAP purchasing power leads to marginally statistically significant reduction in food insecurity. And the magnitudes are not small, and they're sort of consistent with the literature that looks more broadly at the effect of food insecurity. It does not affect kind of more extreme measure of food insecurity, for which the mean is only 4%. This is someone who would have to say yes to a lot of those questions, including like my kid didn't eat for a whole day, and what we know from other work on that is these are much more dysfunctional households. than small manipulations and resources to fix. So it kind of makes sense from that argument. So the results for the effects on health, I'm going to show you two tables. One is more utilization and one is more health outcomes, given the data that we have. And the reason why there's a vertical line in this table is that for those of you maybe who haven't used the NHIS data, some of the measures are asked of all children in the household. For example, did you delay or forego care in the last 12 months for this child? And some measures are only measured for, they just pull a random child from the household, what they call sample children. They do the same for adults. And so the things on this side are only asked for a subset of the kids, and you can see the sample size reflects that. And on the right side of the vertical line is what's measured for the full sample. So what you can see from this is that we find that did the child have a checkup in the past 12 months? Increases statistically significantly. Whether there's a doctor's visit in the last 12 months also increases, and there's no statistically significant effect on this ER visit or delayed care, although they both have the sign you would expect from a higher amount of purchasing power. And you can see that these impacts of a 10% increase in SNAP purchasing power, have sort of moderate impacts on these outcomes. In the health outcomes domain, what we find, so you can see the range of outcomes that we have, mental health for the child, obesity, self-reported health status, or parent-reported health status for the child, the usual 5-point scale, excellent, very good, good, fair, poor, or whether they were hospitalized overnight. And what you can see is the only finding that we have that shows up in this model and is also quite robust to anything we sort of add to it is the result for school absences. So a 10% increase in SNAP purchasing power leads to about a 20% reduction in school absences, though it doesn't seem to change the sort of, if you look at the distribution of school absences, where it is, this is 5 or more days missed. The mean of that is about a third. And you can see that it doesn't change that statistically significant. So it doesn't seem to be changing the tail. It seems to be changing things more more in this continuous fashion. So the next thing we do, of course, is like I'm throwing a lot of outcomes at you, and we should be attentive to the fact that I'm showing you multiple outcomes. So here we show the results for each of these two tables in index form, where for each outcome we minus off the mean and divide by the standard deviation, so it's in standard deviation units. And you can see that the results for the healthcare utilization, which is operating through that, do you go to the doctor, remain statistically significant, but across all those many healthcare outcomes that I showed you, of which the absences is one of them, it does not remain statistically significant. So I'm not, in the interest of time, I'm not going to go over these, but I'm not going to show you only a couple of tables. As I said before, it doesn't seem to be operating through health insurance. It doesn't seem to be operating through other programs. The one thing I want to show you is, as I said in the beginning, to me, this general finding of more likely to get your child to a well child visit and fewer absences from school seem to be most consistent with this pathway of scarcity, poverty, scarcity, and so on. Like if this was truly measuring a health outcome, I guess I would have expected it to show up somewhere else, though maybe we're just simply not powered up to do so. That's possible. But we wanted to investigate in particular what we could observe about mom's mental health, because if it's operating through that channel, you read the literature, it should show up there. And so these are the kind of outcomes that we have, and then there's an index on the far right, the K9 index. And all of these, except one, have the quote right sign, that is they're negative, more purchasing power, lower incidence of these reports. And this is I've dichotomized these to be equal to 1 if you answer that I feel sad, for example, some, most, or all of the time. That's what I classify there, and you can see the means of these, around 10% or less. But nothing is statistically significant. So we can't say anything about it operating through that channel from this information. So let's see. Other other kind of usual specification tests to try to look at this. I can't show you an event study because this is a year-by-year event, so it doesn't lend itself to that. But if we add a lead of the variable, that's not statistically significant, so that's encouraging, and it doesn't sort of change the main effect. If we look at a group, we look at two groups that have very low utilization of SNAP, highly educated women or college and above, or or non-citizen children who are mostly ineligible. And you can see that there's like all zeros. So these are the results for the high educated women. It's encouraging. That's really, those are sort of the results. So if you were to sort of go through the robustness tests in the table, the results that I focused on, in particular, the well checkup and the absences remain very robust to all these findings. So that seems to be what we're finding. And so what we conclude from that is that we show evidence that SNAP operates in terms of affecting these outcomes. And so, really the question is, what is this capturing? And it still seems to me to be most consistent with not the direct health channel, but these more kind of indirect general alleviation of stress and resource constraints in the household. But I think we need to do a lot more to be able to really nail that or say that with more confidence. So thank you. Thanks very much for your time.
Thanks, Hilary. Thank you, Rebecca and Sylvia, for having me discuss Hilary's paper. And the nice thing about coming after Hilary is she always explains things clearly. And so I don't have much work to do in terms of explaining what she did. So, the first few slides, we can flip through those fast. So SNAP is this national program, and essentially the benefits are the same whether you live in Mississippi or in California. But obviously the price levels in Mississippi are lower than that in California, so your dollar goes further in Mississippi than in California. So they're not going to use this cross-sectional variation, they're going to use variation in the time, over time in an area in the purchasing power, but this is kind of the basic idea. Interestingly, as a side note that I learned from this is my state of Alaska is on a different benefits.
Yes, that is true. I forgot to mention that, right?
It's always
the only place.
It's always forgotten in
always
in
forgotten.
national analysis. I noticed that there are like 3 different schedules or something depending on how rural Alaska is.
Yeah. The
Unfortunately,
power of
not enough
Alaska
people.
lobbying.
Yeah. Okay, so what they do essentially is there's this thrifty food plan, which, as economists, TFP means something else. Right?
Exactly.
So the use of acronyms is not universally accepted across, even within economics. And so it specifies this basket of goods. And so they're going to look at the price of this across different market groups and across time. And then that's going to be the denominator for their measure of the purchasing power, and the numerator is just going to be the federal SNAP maximum benefit. And they're going to include geography and time fixed effects. So this variation, which clearly Hilary displayed, which is going to look at within an area over time. And so obviously, and you guys all mentioned this in the discussion, is like, what should we be worried about? So there's other things that could affect local food prices and we need to control for them. And so one is this other set of prices, which you've controlled for, and maybe, I was thinking kind of throwing the kitchen sink at it.
Yeah.
You don't really care about the effects of those
No.
things, but considering some flexible functional form, even interactions of those variables, might be really important.
Mm-hmm.
So I would sort of squared, interacted, splines, things like that. This you can skip because you did control for Medicaid and CHIP. And then other economic conditions would seem to matter because the unemployment rate is an important variable to include in the regression. And I was thinking, I know and you're using these data from a former PhD student of mine, that you can actually kind of compute unemployment rates by specific demographic groups.
Right.
And so I wonder if you could do that, because the overall unemployment rate might not be the right unemployment rate
Right.
for the low income population.
Absolutely.
So, and Hilary again mentioned this, is like coming up with this measure that they're going to use as the independent variable, this purchasing power, the cost of the thrifty food plan, is probably more complicated than I think it is, even by reading the paper. There's this mapping of these 52 quarter food, blah, 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 into 29 TFP food categories if you follow some previous work. But I wonder if there's alternative ways of doing this that might seem reasonable, and I would just see if things are robust to that. Unfortunately, there's probably too many alternative
Right.
ways of doing this. And
Right.
I was also thinking when you were presenting it, just sort of trying to get at that different stores have different price. Like, for instance, the local corner shop
Right.
might be very different than the mega grocery store. And
Right.
so if you compute TFP and using different store chains, does that result in very different TFP measures?
Yep.
So I kind of wondered, and I imagine that this might be another paper that's happening. What's happening in terms of what people are consuming? So prices change. Are they changing the quantity, the quality of the food they purchase? But what about other things they consume? And so I was thinking, like the CEX data might be useful on that domain. It addresses one of the 3 channels that you were thinking about. So I think that would be very interesting. So this appendix figure 3, Hilary showed in her, like one of the figures she showed, which shows the time path across each of these groups in the measure, their main measure. And if you remember, San Francisco was an outlier.
Mm-hmm.
And I wonder how robust the results are to dropping San Francisco.
Mm-hmm.
Also, New York is kind of an outlier.
Mm-hmm.
It might be useful to see that graph taking out county and time effects, and then we can actually see the direct variation that you're using.
Mm-hmm.
I also think maybe you want to drop the very end of your sample because that's the start of the Great Recession.
Right. That we've done just recently, and the results hold for dropping that. But that's a good point.
And I was also thinking about how do we characterize the variation there? Like, how big is the price changes within an area, and how can we relate that to SNAP food policy changes too? Then I was also thinking about WIC, and WIC has more geographic variation, but there's big county level variation in WIC. Of course, it would be impossible to take on this, but I wonder if there's an interaction between WIC and SNAP that if SNAP is less generous, then WIC becomes bigger. So you could drop families that would be eligible for WIC. And then there's also the question that I'm sure that a referee would give you, which is like, what causes this local variation?
Right.
And so having some story on why that is, I don't know. That paper by Stefano Della Vigna and Gansco, I don't know if it's illuminating that regard. They show, from what I remember, is within the same store chain,
Right.
Even though there are geographic differences in cost of living, the same product is the same price, basically. And then I was wondering if so everything you're doing now is contemporaneous, so the purchasing power affects outcomes today. I wonder if there's there's a lag, especially with the health stock variables that might help today depended on what SNAP levels were a year ago. So just to sum up, this is a really important study in this domain because, as Hilary illustrated at the beginning of her talk, there aren't a lot of studies that could use quasi-experimental data to estimate the effect of SNAP. I think, and one of the things that I would think might be really important to expand upon, and there was a little bit of a side discussion when you were up here talking about how we don't geographically adjust a lot of federal programs, and what kind of effects does that have on people. And so I think you could say something in that regard, and I think that's really important, especially when you're mentioning that we have this supplemental poverty measure and we're not using it, but maybe we should, and this might be an indication of like maybe we should use that because it's important. And then the more conferences I go to, I see this phrase, social determinants of health. And so I think amongst a lot of social scientists, we're interested in reducing healthcare costs, and so there's been more focus on trying to not change the healthcare system, but change more social determinants of health, or influence healthcare use through social determinants. And I thought it was an interesting, innovative new use of quasi-experimental variation in SNAP. So thanks for.
Thank you very much.
It was a great read, and I encourage everyone else to read it too.
Just one quick question, I might have missed it, but do you look at food not at home, or does that affect anything?
Right, we don't, because that is not part of, all we observe is the health outcomes, we're not observing what they're buying. And and SNAP only allows you to purchase food in the store, not at restaurants or whatever. So everything that we're looking at is operating through the price of things that would be in the grocery store. I mean, that could be an interesting thing to look at, but just not within what we're looking at here. Yeah.
I'm wondering about actually the education channel, and if you look at school days missed generally as opposed to missed towards illnesses, and if you're really thinking about the health channel or the education channel, and whether there's a big difference by age, like I imagine that age for younger kids having health illness checkup has a bigger effect on school days missed.
Right.
Teenagers probably not.
Right. Yeah, I mean, I don't want to just like bury our own results, but it's pretty crude data. You ask someone in a survey how many days of school your kid missed last year due to illness. You're right. I didn't say that. That is in the definition, though. I don't know how people respond to that. I think it would be much. What I would like to do would be much better is to have, if you had district by district level on absence rates, that would be both at a smaller, a more granular level, and probably much better measured in order to really get at this. But there's you can get this for some districts, but there's not like test scores for the United States. They're not absences for the United States. So I don't know very much about whether and how that this variable has even been cross-validated against actual school miss and for what reason. So I feel it's fairly crude.
Is there any variation of when the people get the benefits? When in the month?
Yeah, so I didn't put that up there, though. There is another literature that it's kind of answering a somewhat different question, but it basically, it started with this Jesse Shapiro paper,
Right,
which has
third
now
of the
been
month.
found in a lot of different settings, and it's sort of related to Jay mentioning the Stephens paper on Social Security checks on the third of the month.
Right.
Is basically looking at the so-called food stamp cycle. In other words, in most states, in all states you get just one food stamp disbursement per month. And there's an algorithm for, you know what that is. And so folks have looked at that and looked at different kinds of outcomes. It's a within month thing, so it's a totally different object, but very interesting.
Yeah, but for the bandwidth, I think that's
Exactly,
where it,
right.
the bandwidth
Exactly,
is your.
so the question is, if you've got a bit more, is there less of this? Is there less of,
Right.
so the finding for those who don't know it is basically everything that you observe, there's less of it at the end of the month. There's less buying food, there's less eating food, there's less, and it seems to drop in the last week. And there's a really interesting study that shows that, particularly for older folks, there's more, and you might say, well, there's recall bias or, all sorts of problems. But there's this recent study that shows that there's more admittances to the hospital for hypoglycemia in the last week of the food stamp month, and in particular in high poverty households versus low poverty households. So that's like a completely different, measure than asking people what they ate last week. So it does seem as though there's real mounting evidence that people, even though they food stamps month after month, you're still not allocating within the month, which started with Jesse's paper was really about the behavioral story, but it's really kind of fed into a broader. And I was at this conference once, and I was on this panel, and it was a very interesting panel that had a school principal and like people on the ground and like me, and the school principal was like, oh yeah, I know what date the food stamp benefits come out. I see it in my school in terms of the number of misbehaving that happens in the school is very obvious in the last week of the month.
So everyone gets it at the same time.
In most states, everybody gets it on the same date. In some states it varies, but in many states, and in that state, which was like North Carolina or something, they did get it all on the same date. So there's some experiments going on right now. I think one in somewhere in the Northeast, I forget where they're testing splitting it up over the month to see what effect it has.
Right.
And I think there's a lot of people who talk about that as being an important policy innovation, but I don't think we know much about that yet. But you're right, it's a whole other source of variation that is, a little bit different than what we're doing, but it's obviously a related and important work.
Do you have? Sorry. Do you have information about how long ago they became eligible for the benefits or nothing like that? Because I'm thinking some of the effects may be cumulative, right? Like you would expect food insecurity to fluctuate right away, but these health outcomes or utilization could take a while.
Yeah.
So
you're absolutely right.
No way.
I suppose we could kind of use a similar approach that Jay used to sort of like identify folks that are kind of more disadvantaged and expect to have been on for a longer period of time. That's an interesting idea.
Yeah, so I think Christina Roberto at the University of Pennsylvania is doing work on what you were proposing, that is looking at sort of the different times of the month and whether or not that impacts any health outcomes. And she's at Penn, and she's a social epidemiologist and psychologist. So my question was about whether or not states are evaluating programs where they have this sort of one-stop shopping approach. So I know when I lived in Rhode Island, they were thinking about implementing a program where, regardless of where in the social services sort of arena you enter, they evaluate you for other programs.
Right.
And so, are you aware of any of those types of programs and how that might impact?
Yeah. I definitely hear that. That's talked about as a real limitation of California, which is a very fragmented system. And so I don't know, in the policy part of what I sometimes engage in, there's a lot of discussion about moving to one-stop shops. And a lot of people are talking about, well, everybody's on Medicaid, and we need to bring more of this into like the hospital setting and the clinical setting where people are there and do this, like let's do the whole person view. And I think some states like Rhode Island and others are real leaders on this. I think Wisconsin is pretty good on this. California is not, I can tell you that. And I don't know of any evaluations of that per se, though that would seem like a very interesting thing to look at, particularly through just the take-up channel, which is important. Like food stamps is, like California has the lowest take-up rate in the country of food stamps. At so take-up is conditional on being eligible, how many people participate, and I think, I'm gonna get the numbers wrong, but I think we're at about 60%, and the national average is like 80. I mean, we are a massive outlier. And I think there's a lot of reasons, but one of them is that we have a very fragmented system, and the counties have everything is devolved at the county level, and there's massive variations on what counties are doing. So there's a lot to be gained there. There's a lot of movement that could go on.
A quick comment on your econometrics. So a ratio covariate is always tricky because a 10% increase in purchasing power could happen to the denominator of the numerator. And I'm not sure if it matters. Maybe there are different theories that would have happened. But you could easily test that by taking the log of the numerator and denominator separately and
Right.
see if the coefficients are the same. And maybe there will be different kind of theory or question come up if they're different.
So one criticism of our paper is that this isn't about SNAP at all, this is just about prices. So why are you saying it's about SNAP?
Or income levels, basically.
Right.
Yeah.
And I think that's kind of legitimate, but my counter argument to that is yes, but those who are eligible for SNAP is a big part of their, there is a difference because somebody whose income is higher, not just has income higher, but their kind of like risk of fluctuating income is more determined by wages and employment and not this other thing. But econometrically, if you think about it, we've got time fixed effects and the numerator only varies nationally. So essentially we're gonna get the same finding if we just put the log of the thrifty food plan in there, as opposed to the ratio.
No, but the betas could be different on the log of the.
But I can't
log of the
identify
price.
the beta on the log of the numerator, because it only varies by time. So with time fixed effects, I can't identify a beta on that. So I can't test that. You see what I mean? Like literally, it just varies, it's national. The numerator is national, so it only varies by time. So I can't put in the log of the benefits and time fixed effects, because they're not separately identified. Right? Just like I can't put in the national unemployment rate, I can only put the area unemployment rate.
Yeah, I
So-
thought the benefits were individual level.
No,
No.
the benefits are just the national benefit for a standardized family size.
I see. Okay.
Because the actual benefit you get is endogenous to how much
Right,
income
right,
you have.
right.
So we don't want to use that. We could use it by differences in family size, but that seems unattractive. So it's just the national. So, yeah.
So, given that eligibility is determined by this federal poverty line, do you think people might move in response to where they think a certain amount of welfare might just buy them more,
Right.
and then what that might mean for your life?
I mean, in principle, that seems right. Certainly theoretically, that makes sense. I guess I would say, like, zooming out a bit, there's many other elements of the social safety net that vary across space by more, that if you were making those strategic location decisions, those would be the drivers. So, for example, differences in cash welfare, or unemployment insurance, or Medicaid are much greater across area than these kinds of more, admittedly, marginal price variations. The work that looks into this finds that, essentially the poor move for more labor market differences a lot more than they move. Like the pull factor of the labor market turns out to be more important than the pull factor of differences in social safety nets. I think that's probably the takeaway from the evidence, though the evidence is limited on this. I think, it's a good thing to be thinking about.
I was thinking about.
Oh, sorry. Yeah, I see you back there. You're hiding.
I was thinking about your maternal health, mental health slide.
Yes.
I was wondering, is there a way? It seems like that comes from a scale. Is there a way to combine those instead of just looking at them individually?
Yeah, sorry, I went over that quickly. The
But-
K6 scale
Yeah.
is an index of them,
Yeah.
where they're combined not only across the columns, but also
Right.
upweighting
Okay.
the severity of, because it's a multi-point, so it's a standardized K6 scale.
Right. If you
And
look at
so,
that, there's
and
no
that,
difference.
right,
Right.
yeah, somewhat disappointingly. Thank you so much, everybody. That was super useful. And thank you, Heather.